Hello, let's continue talking about medical codes. In this example, we're going to talk about the code used for procedures and surgeries. It is the CPT code, it is the billing code, and it is maintained by the American Medical Association, and it is not free. You have to pay a license for this. But I heard that we can use a short name version, and we have already uh, populated e-patient index with a list of CPT code. So what is the work you're going to be doing for the patient community when you are scheduled for a procedure? You're going to ask the doctor what is the name of this procedure and what is the CPT code of the procedure that the doctor is going to do. Then with that info, you just go into Google mode. Let's say you are scheduled for 67113, and you just Google your best source. For example, let's use this one, Bioportal. This is the CPT code, and this is the synonyms, vitrectomy, and you see other details there. Remember, a patient index is about diagnosis, making sure you need this procedure. Once you need this procedure, it's enough for us with the consumer name. After you need this procedure, then that's the doctor's territory. How you help other e-patients? You come here to the CPT admin, and as I said, we already populated your CPTs for you, and only thing you do is you update the consumer name. And remember, there's another video. If you had this surgery before somebody else, then we're going to do a favor to future patients by providing here the default risk, alternatives, and instruction. But there's another video for that. That is enough. Remember, this is a statistic provided by Patient Index, and then you save it. So now a future patient can find this CPT code not only by the code, but also by the consumer name. It is very important to keep a patient index free of free text because the use of codes will facilitate that when another patient is scheduled for the same procedure, it's easy to get feedback, smart data. For example, you're going to get the consumer name and the default risk, alternative, and post-operative instruction as specified by another patient. And we can provide real uh, scientific data. For example, we can specify what CPT code is acting on what ICD code. And that's why it is important for us to keep e-patient index free of free text. If you need to include a procedure that you don't find, again, the same technique. You're going to ask a super e-patient and a patient master, please include this surgery. And then assign any CPT code because what we're going to do is that we're going to uh, normalize that information for you so you don't have to include garbage uh, information in the system. Thank you.